Let's now proceed with the first panel, talking about brain transition economy. This session will explore how Spanish brain plan can serve as an anchor for implementation while informing European and global pathways for advancing the brain transition economy. This session will be moderated by Professor Ayadi, founder and president of the Euro-Mediterranean Economists Association and co-founder of the Brain Capital Alliance and the Brain Economy Hub. Professor Ayadi, whenever you want, the floor is yours. I just got it here. And joining Professor Ayadi, we will also have here, and as a panelist, Andy Moose, World Economic Forum. He will be just right here in remote in the next few seconds. But also let's receive here on stage Lucy Pérez from McKinsey Health Institute. Marta Dierssen from Center for Genomic Regulation. Josep Argimon from Barcelona Beta Brain Research Center. And Marta Sánchez Bret from WeMind Cluster. Professor Ayadi, whenever you want, the floor and the audience is all yours.
Marta, should we get the slides?
Good morning. Yes, good morning, everybody. It's a great pleasure to be with you today. First of all, I would like to thank Marta for hosting this fantastic event, and it is extremely timely for where we are today. And also, I really would like to thank you for the partnership. I remember when I came with the idea of brain economy and brain capital many years ago. Yeah. It was such a, what is brain economy, what is brain capital? And I would like really to thank Keisha for the great presentation, because really you give it the answer. I'm an economist and I'm a finance professor, and I always was fascinating how the brain functions. And sometimes I think maybe I should have studied neuroscience to better understand our brains. And as economists, interestingly enough, we believe that our brains are simply utility maximizers. I always say this, that humans are not only utility maximizers, and this is the basis of our economic theories. And this also means that our economic models might have been disrupted or eventually reflecting a simplistic approach on how our brains functions and the executive function. And thank you very much, Keisha, on bringing this. It's the bridge, as you said, between brain health and resilient societies. So before, as economists, we think of efficient economies and societies. That this means that we need to maximize growth by enhancing our efficient decision-making and efficient economic models. But in reality we've been faced the reality that we need to develop resilient societies. Resilient societies cannot be not human-centered. They have to be human-centered and at the same time, as you said, protecting our executive functions. So I'm not going to dwell into what I call the challenges that we're facing. We all know about them. I think we are not going to, we have already been aware that our societies are facing tremendous challenges, from demographic changes, digital transitions, green, or I wouldn't say green, it's climatic risks that we are living. And this all brings us to heightened level of stress and eventually implicit burnout already by looking at how our societies and economies are evolving. So in reality, what we're bringing here, brain capital, is the interaction of 3 pillars. And you mentioned this is our framework, and we are even trying to measure it. We are developing, or we developed already a dashboard which connects practically more than 24,000 data. And I would say that for economists, what is essential is data. We try to be able to have a clear view on what we would like to change. We need to be able to measure what we would like to change. And this has been a tremendous challenge. And I look at the brain health experts saying that we need as much data as possible and as clear definitions as possible to allow us to integrate this brain health or brain capital into our economic models. Now, brain capital innovation is the brain skills, and I still believe that our brain skills are suboptimal because we've been only focusing our brain skills on the labor market and how the labor market should function efficiently and creating value for the enterprises, and then eventually we end up into what I call a consequential burnout and chronic stress, which in turn will lead to an executive function which is impaired. So it is really a defeating purpose of our, I would say, objectives to enhance our society. So all of this will lead me to, okay, the brain economy, it's an economy which hopefully we are all contributing to, that centers brain health and executive function into the center, together with rethinking brain skills, which will lead us to more flourishing and more resilient societies rather than efficient societies. Of course, we need to have efficient societies, but then this is not eventually the first objective of our construction of what I call flourished societies. So with this, I would like to welcome our panelists today. We have fantastic lineup. Here we have Andy Moos online, World Economic Forum, and he will share with us the projects that we are all working together within the Brain Economy Action Forum and the pushing for having a more resilient societies at a global level. So thank you, Andy, for being with us today, and hopefully we will see you again, I would say face-to-face. That would be fantastic, but we will listen to you. So Andy, he's the head of health and wellness at the World Economic Forum. To my right side, Lucy Pérez. Lucy will be working together with your team at the McKinsey Health Institute. She's senior partner and a believer of the brain economy with all the team. So thank you so much for making this new thinking, or say new paradigm, a reality. Also have Mara Dierssen. Mara, she is the president of the Brain Council of Spain. And when I met Mara, I think we had this great connection. She's a neuroscientist and also the head of the Center of Genomic Regulation. So there is this connection, which is very interesting to make. And we are all working together for the implementation of the brain plan in Spain. Josep Argimon, he's the head of Barcelona Beta Brain Research, also a former Minister of Health of Catalonia. Thank you for being with us. And Marta, my dear friend Marta, so I'm not going to present her, you all know her. And she's also in the, she's the head of the cluster, mental health cluster of Catalonia. And this is really, for me, this is my personal opinion, is the example to mainstream brain economy into the economies of the European countries and beyond this. So without further ado, I give you the floor, Andy, to give us a view on where we are in terms of the brain economy implementation globally, and then to you. All.
Thank you, Rem. I appreciate it. And, you know, I think just to get started, I'll begin to discuss some of the concepts driving our work that we're doing in partnership with the McKinsey Health Institute, and then I'll pass it over to Lucy to really bring some local context in terms of what that means in Spain and in Europe and our work there. So, as Professor Hartikainen mentioned, and you mentioned as well, Rim, I mean, why does this matter right now? Why do we at the World Economic Forum with our partners feel that right now is the time to frame this focus on the brain economy, and why this is a moment to really build action and momentum around this? I mean, as we mentioned, we're living in an age of constant disruption, and that's capturing the attention of global leaders. The question is, what do we do about it now? These stories, if you look across the lifespan, increasing incidence of mental health in young people, challenges we mentioned, chronic burnout, instability in employment through midlife, and then challenges with cognitive decline, social isolation, and other things affecting us as we age. And so these stories reflect really a global reality that we're seeing that are influencing day-to-day decision making. And we feel that this is an important concept around the brain economy to bring forward now, to focus ourselves in a way to look at, well, what do we do about it? How do we really influence and improve the way that we, how we're learning, working, and aging as a society? And so really from these early life disruptions, as we mentioned, across midlife and into cognitive decline in later years, these challenges do accumulate and really weaken that shared capacity to learn, adapt, and grow. And so we really want to look at, okay, well, what is the framing that can help global leaders look at this in a different context? And so if you remember just one thing from our presentation, this discussion today, let it be this, that stronger brains mean stronger individuals, stronger communities, stronger economies, and ultimately stronger societies. And so we really have brought forward this concept of, or the analogy of a tree that really, okay, well, what if we're trying to foster brain capital, if we look at its roots, those are really grounded in brain health and brain skills. When we nurture those two things as a society and as economies, we really create the conditions for people to reach their full potential. And we feel that that is a framing that we've not seen previously in terms of the way economic leaders and leaders of organizations are thinking about and looking at the topic of brain health. And so we really want to try to, through our work together, focus on creating stronger brains that really can help individuals learn, connect, and contribute in meaningful ways and sustain that across the lifespan. And so we really feel that together that will allow us to power stronger businesses, stronger economies, and really drive a shared sense of growth and well-being that does translate into societies that are more cohesive, more future ready, and ultimately more sustainable and resilient. And we do feel that, in the midst of these shifts, it provides this opportunity to really focus on advances that are being made at a rapid pace. And so we feel that the need to nurture R&D in that early stage development to really see these innovations reach scale, that's something that is an economic opportunity that's being missed to some degree with the over focus or perhaps on some of the more near-term threats. And so we really feel that taking a much more deliberate approach to engaging around embracing AI and embracing these rapid shifts and really on the human skills that we need to adapt to this era, adaptability, empathy, focus, connection. These are the very skills that will make our societies resilient and innovative, but we're not cultivating them in a consistent or cohesive way. And so we really feel that to really meet this moment, we need a new way of thinking that really looks at brain health and brain skills as this focus as an asset around brain capital. And that this is really the time to focus on cultivating that. And so just to explain that in a little bit more detail, so what do we mean by brain capital? Brain health, it really refers to broadly to the full range of conditions and factors that influence how well our brains function. And so we're looking at how that function from a mental, neurological, and substance use dimensions. Also mental health really is not separate from this conversation. We also view that as one of the core pillars. When we look at brain skills, we're talking about a foundation around cognitive, interpersonal, self-leadership, technological literacy abilities that really help people adapt, connect, and contribute meaningfully. So while nearly all human abilities are mediated by the brain, here we're referring to brain skills as those which really draw on higher order cognitive, emotional, and adaptive functions. And a good way to think about that is really the difference between following a known recipe versus inventing a new one under pressure. Brain skills drive creativity, collaboration, resilience, and increasingly are critical for productivity and innovation. And also we use the term as a shortcut really for non-technical capabilities that are often overlooked in education but are essential to human performance. And so these two dimensions of brain health and brain skills are indeed interdependent and do reinforce each other. And really that comes together in what we're referring to as brain capital, which is really that collective value of healthy brains and strong skills that serve as a strategic and economic asset for individuals, but also for organizations and their cultures and performance, as well as societies and overall economies. And that's really why we view investing in brain capital not just as a moral imperative that benefits health, but also it's one of the big bets and one of the smartest economic investments that we feel we can make for our shared future. And so with that, I want to pull Lucy into the conversation here to talk a bit more about what does that mean in Spain, and how do we translate that from a global dialogue into specific country level plans and engagement.
Thank you, Andy. Lucy, to you.
Yes, no, thanks so much, Andy. As you can tell, Andy and I are spending a lot of time together. And anytime you're tackling a big problem, right, and a big opportunity hand in hand, it takes collaboration, which is why I'm so excited, right, that we have this opportunity to be here and all that we get to do together as part of the Brain Economy Action Forum. I do have a few more slides in here. They come great. And so what we thought we would do is, building on the frame that Andy set up, is actually talk a little bit about what it means for Spain, right? And so, okay, let me see if maybe I am in control of the slides. I am. Look at that. Amazing technology working with us. So let's take a look at what does this mean for Spain, right? And so Andy did the definition of what do we mean by brain health, right? And look at what is that burden of brain health disorders in the Spanish population. It is about 30% of the total disease burden. That is a really big number, right? We're talking about close to a third of total disease burden is tied back to neurological conditions, mental health disorders, substance abuse disorders, right? Close to 50% of this is neurological, is what you see here on the left side of the chart. When you translate into what this means in terms of disability-adjusted life years, we're talking for Spain only, right? 4 million DALYs. Like, those are really big numbers, right? And then you start thinking about, how many people suffer from a mental disorder. It's about 1 in 7, the statistic globally, right? This happens in every family, in every workplace. And so we can talk about these really big numbers, but think about at the cost at the individual level, right? And it's not just the individual, but it's those who surround that individual, right? Who are providing the caregiving, who are the co-workers, for example. And so you start adding this all up, and very quickly numbers get really astronomical in terms of like the scale of the challenge here, right? I mean, you see one of the stats on this slide, the $1 trillion associated in lost productivity, just related to 2 of the conditions, anxiety and depression. So it's easy to go down this rabbit hole and be like, oh my God, what a massive challenge. I want us to look at the opportunity, right? Because that's where I think things get really exciting about how do we not only add health, but strengthen the economy. And so what you see here is the analysis that we did to try to size what is that opportunity in terms of how much more we can get the economy to grow, focusing on brain capital. And what we did here is actually build on the example from a framework that was used in the HIV response that, I think it really galvanized folks. And this is the 90-90-90 framework. I don't know how many of you in the audience may be familiar with this, but if you're not, it basically comes from a place of saying, let's make sure that 90% of patients know their status, right? Know their patients, right? Let's make sure that 90% have access to treatment, right? And 90% can pursue that treatment to recovery. And that's basically the math that we applied. Imagine a world where 90% of people know their brain health status, right? 90% have access to effective interventions because guess what? The good news is we have a lot of evidence around what works, right? We were hearing some of that in the prior presentation, but we have the tools, right, for a lot of positive change, and 90% of folks are able to implement that, right, and be on their way to recovery. If we did that in Spain, we're talking about adding $56 billion to the Spanish economy. It's about a 3% growth. That is not insignificant, right? And by the way, we think these are very conservative estimates when it comes to this. And you ask, what's behind that number, right? And yes, we love numbers, all of us, I think, in this audience. And it's 5 big levers, right? Which is basically first saying, how do we reduce the time that is spent in poor health, right? Be it sickness or disability. How do we make sure that we can drive greater engagement at work? Oftentimes, when people think about lost productivity in the workplace, we focus on absenteeism, those days where we don't show up to work because we're in poor health. But actually, a much bigger driver of lost productivity is presenteeism, which means you are showing up to work, but you're not showing up in full health, right? You're not bringing your full creative self to work. And that's what we mean by that higher engagement at work, right? And of course, there's other things like reducing early deaths, increasing earning potential, and very importantly, thinking about how we can expand the opportunities that today are providing a lot of unpaid caregiving. And so when you add all these things up, we're talking about those $56 billion. That is a pretty significant opportunity. So that's where I would hope, if you're going to remember one number from this presentation, this may be the one that I will emphasize. We can then have a debate amongst the panelists which one to focus on. But why is this also important? We all know we're in the middle of an AI revolution, and hand in hand with that is a question of what are the skills that matter? Our friends and partners at the World Economic Forum have been tracking for a long time what are those critical skills to economies and growth, right? And what you see on this chart first are those that have been identified as the top 10 skills for 2025 and what it's being projected for 2030. Highlighted are those that we consider brain skills. So what do you take away from this? The absolute centrality of brain skills, right? We're looking at least 6 in each of these columns of the top 10 are brain skills. And at a time where we are anticipating that over 60% of workers worldwide are going to get upskilled as a result of this AI revolution, this becomes really important because there's a lot of conversation about, are we realizing the full potential of AI? And I would almost argue we cannot realize that full potential without getting the brain skills part of the equation right. Because it's only when those brain skills that really help us develop better focus, learning, creativity, adaptability, resilience, when those are in place, then AI can augment human potential, not replace it, right? And that's when we get to that best model of truly unlocking economic growth. The QR code, by the way, there, if you want to scan that one, that's the one that leads to all the research that you are seeing on this slides. Very quickly, why am I excited and optimistic? And you can probably sense it in my energy. It's because we're seeing so much more momentum. The term brain capital came about in 2010. And in the last 15 years, it's really remarkable to see how people have come together, the level of collaboration, of research and understanding that's happening all over the world. We're particularly excited about the Brain Economy Action Forum, that it's bringing together organizations like the Euro-Mediterranean Economists Association to work together around how do we mainstream brain economy, right? How do we recognize that investment in brain health and brain skills is really what's going to build much more stronger and resilient societies? And so As part of the Brain Economy Action Forum, we are participating in several events like the one right here to collect more input, right? To figure out how do we ensure that the plans as they're being built are robust and reflect the needs of different societies. Because the reality is, if we want to get to that society that we dream of putting the brain, as a key element, our human nature at that very center, we need to come together. Everyone has a very big role to play. And that's what you see here. This is not just about the private sector, not just about the public sector. It's not just about the health sector. We all need to come together, and we need to take action. What you see in the center of this slide is the central framework of a report that we're going to be unveiling at the next annual meeting of the World Economic Forum around how do we realize and strengthen this brain economy. And it's these 5 actions you see here. It starts with safeguarding brain health, right, with that as the foundation. And one point I will make, as we think about brain health, let's make sure we do not underestimate or forget about sex-based differences in the brain. I think it's really interesting when you start digging into so many of these conditions. For example, dementia, 2/3 of global patients are women, and 70% of those unpaid caregivers are also women. Or take conditions like ADHD that manifest very differently in women versus men. The understanding of sex-based differences is central to how we're going to safeguard brain health for future generations. Hand in hand with that, fostering brain skills. Next one, how we measure. A really important thing and something that keeps coming up over and over again is how are we defining things and ensuring we have standard definitions, because only then do we get measurements that allow us to be apples to apples, right, as we look across things. Obviously, it's going to take a lot of investment, and for that investment, we need to mobilize. We need to have the right messages, the right tools, the right understanding, the right evidence that ultimately helps us realize that if we take all these actions, not only are we going to have healthier individuals, we're going to have much stronger communities and really thriving economies. So really excited for our conversation today to build a stronger economy for everyone. Thanks so much.
That's great, Lucy, to remind us about the measurement for economic policy to at least have an impact and influence our economies positively, or moving into a brain-positive economies. We need to measure correctly and have the right matrix for this. And I completely agree, because this whole movement of brain economy started from neuroscience in collaboration with economics. And really, I'm quite honored to work with people like Harris Ayer. He's not with us today, but he has been really leading this process over since actually 2020. And I think when I remember I got to know Harris, he told me, neuroscience, it's really moving us into what they call neuroscience policy action, and it was hosted at the beginning, just to give some history, in the OECD, together with another colleague economist, William Heinz. And we were imagining, in fact, a new paradigm, or what we call the new within the new economic thinking, to drive our economies into more resilience and more flourishing. So this is also was a, I would say, emanating from research, and more than research in neuroscience, it's the interdisciplinarity between different disciplines. And I think this is what makes it rich and really bringing the results and of different independent research that allow us to advance our economies and also to respond to the societal challenges that are more and more complex. So one discipline might not suffice to give the right answer. With this, I would like to introduce Mara. Mara, please, the Spanish brain plan, and how do you see it?
Thank you very much. And can you hear me? Yes. I hope I will get my presentation at some point. So I'm the president, as Rim was saying, of the Spanish Brain Council. What is the Spanish Brain Council? It's a non-profit association formed by most of the scientific societies that are dealing with brain research, psychiatry, neurology, but also patient associations, foundations, independent foundations. Fundación Pasqual Maragall is also member of the Spanish Brain Council, and also other actors like industry, for example, companies that are dealing with neurotechnology, etc. So what we try is to speak with one voice because there are two messages, let's say, embedded in the Spanish Brain Council, right? One is that we can't... Oh, they don't hear
Te doy
me.
el micro.
Okay, I will take the other one. Okay, can you hear me now? Yes. Okay, so what I was saying is that this embeds two concepts. One is that probably we should move from talking about neurological and psychiatric disorders and mental health to brain health, because in the end we're talking about the brain, right? Our mind is built upon our brain structure. So this is one thing. The other thing is that we need to really bring, and you were saying also that, the voice of everyone. So what is the situation in Spain? I mean, we have heard already some numbers about, you know, the problems in Spain, right? The numbers are a little bit different depending if you take into account what is undiagnosed, right? There are many disorders that are not diagnosed. And this is why sometimes numbers change a little bit, as you will see. But there are other factors. We are very, longevity is lifespan is very long in Spain. So this makes us more vulnerable to neurodegenerative diseases. So our brain disorder numbers raise, compared to other countries in Europe, more than 2%, right? There are other situations. There is a high youth unemployment. This is connected with mental illness. We have a lot of mental disorders connected to work disability, right? As was also mentioned, and here you have some numbers. So this is the number of mental health disorder connected to workload and burnout in Spain. Mm-hmm. So this, of course, leads to a very strong, as we were saying, burden, economic burden, which is, in fact, much bigger than what we think. If we take into account all the, let's say, indirect costs. And this is why brain economic metrics should be there, right? We need to know how many people are leaving their jobs because of mental health problems or the presentism that you were mentioning, right? Which is more difficult to measure, but we should. And in fact, you know, we need brain-friendly workplaces also, as we heard before, right? Just if you go to a medical checkup, you immediately get an echocardiogram. You never get an EEG, right? Mm-hmm. Never. You have to go to a neurologist, right? So we have heard the pressures of digitalization, brain transition. We need to change our model to a more creative and resilient and adaptable model, right? And in fact, we believe from the Spanish Brain Council that this is something that we need to do in Spain. We need to protect our brain capital. We have a huge brain capital. We are a very creative society. But we need to boost this, and we are not doing it. Look at the education. We start by, everybody has heard the sentence, education kills creativity, and then we need to go to courses to say and recover our creativity skills, right? So, and in fact, I will not make more emphasis on that, but we have thought about some measures to really boost brain health, and this is the Spanish Brain Plan, right? And we really need to focus on those pillars. We are working with all the ministries. We think that this is intersectorial. We need to put brain health everywhere. And it's logic, right? Why are we here? Everything that is here, that you see, artificial intelligence, comes from our brains, right? So it's obvious that we need to boost brain health. So we have developed several pillars in our Spanish brain plan. The first is that we need data. We need to understand the situation, epidemiological, economic data. We don't have registries, but we need integrated databases. And we are boosting the creation of an Iberian brain observatory, right, to do that. Then, of course, we need chronic care. I mean, we need people to recover, or at least to be cared along life, right? So chronicity is a very important word here. And this needs to integrate social care with healthcare and provide long-term and personalized medicine, right? Then research. I mean, the numbers are terrible, if I may, right? The investment in brain research is not covering at all the burden, the economic burden of brain disorders, and even less the need of brain health, right? So this is something that we really need to boost. And there are many aspects that we need to improve. Reduce the administrative barriers, modernize the infrastructures, multi-omic platforms, biobanks, biomarkers. So we need research in biomedical innovation there. Prevention. For us, prevention is crucial because in most cases, when the disorder is already there, it's much more difficult to take it back, right? So from childhood to aging, not starting at when you are 60 to care about your cognition. No, we need to start from the beginning. And then participation of patients and caregivers. They should be in the center. So, and this is basically what I wanted to share with you.
Thank you, Mara, for making sure that this brain plan in Spain is at least agreed. Now it has to be implemented, and of course, action plans will have to be put in place, and all the actors will have to be part of it. Josep, the floor is yours. What do you think about all of this?
Thank you very much, Rim. I will give you 7 ideas why brain health is a strategic factor in the global economy. And the first one is that neuropsychiatric disorders account for the largest burden of disease, overcoming cardiovascular disease and cancer. Globally, almost 40% of the world population had a disorder affecting the nervous system, leading to 11 million deaths and contributing to more than 400 million disability-adjusted life years. So the burden is very, very, very great. Regarding mental health, Lucy said 1 in 7 people live with mental disorders. But also, for instance, if we take psychosis, 70% of the people with psychosis do not receive proper medical attention. And the budget in low and middle income countries, the healthcare budget devoted to mental health is only 1.4. In Catalonia is about 6.5, and around Europe is 8-9%. So we need to improve here clearly. The second idea is that we must take care of mental health and neurological disorders throughout life. Has already mentioned, 75% of the mental problem begin before the age of 24. And at the other at the other end of the spectrum, we find diseases such as a stroke or Alzheimer's disease. Third idea, economic impact. Taking figures from Europe, we can say that the economic cost of brain disorders in Europe is around 800 billion euros, much more than cardiovascular diseases, only 200 billions, or in cancer, 126 billions. Fourth idea, is that although brain disorders or brain diseases represent the greatest burden of disease, investment in research is much lower than, for instance, in cancer. It's difficult to have accurate data on research around the world, but I took the budget, 2024 budget of the National Institute of Health, and 50% of the budget was devoted to cancer research, and only 6% to neurological disorders, or 5% to mental health. So the needs associated with brain disorders are high, but the responses are inadequate or insufficient or both. Fifth, we must ensure and start talking about brain health instead of brain diseases. And we must follow the example of cardiovascular societies and GP societies, which succeeded in shifting the public debate from talking about disease to talking about cardiovascular health. And we have to think that brain and heart are intrinsically linked. We know that healthy lifestyles known to promote cardiovascular health also preserve brain health and reduce the risk of cognitive decline. And we have to follow the campaigns led by cardiovascular societies, the awareness campaigns led by cardiovascular societies over the past centuries, because they can serve us as a model for similar brain-focused programs. Sixth has already been said. Brain health is not only the absence of disease, but it is also promotion of brain skills, cognitive, emotional, and social. And if we take the definition of the brain health from the WHO in 2022, we can move from this idea of brain health to the idea of brain capital, an emerging concept similar to human capital coined last century. And of course, focus now this concept of brain capital on of a modern economy facing various transitions, and also with the idea of promoting a society that fosters the positive aspects and skills of cognition. And we know that brain capital is the foundation of the brain economy. Finally, the final idea is we have to put this concept of brain health in all policies, taking the analogy also with the idea that WHO coined last century of health in all policies. We must say brain health in all policies. I am not going to list all the policies, but I will pick up three important to me. The first one is education and lifelong learning. The second one is healthcare, ensuring universal access to healthcare, particularly mental health. And finally, investment in research, innovation, and science. Thank you.
Thank you, Josep, for giving those ideas. Certainly, we will take them into consideration. And thank you for mentioning that we need to move from the concept of human capital, which was created in the 60s, actually after the Second World War. And then, interestingly enough, it was based on the thinking that only counts is tangibles, not intangibles.
Yeah, that's
and nowadays, we need to move beyond
the intangibles. Of course.
We need to have healthy intangibles.
Yeah.
And this is what is very interesting now, because, in fact, if you look at the economic theories, we are still locked into the 60s and the 70s, and we are completely changing our realities without the appropriate tools. And we need to go fast from our theories or theoreticians to be able to move to a complete different economic paradigm, which is within this new economic theories and thinking. So, yeah, absolutely, we are in the same line. Actually, my interest as an economist is to move from human capital to brain capital. And even beyond this, connecting with the planet, nature capital. And this is also one thing which we need to do. because we cannot live in isolation. You know, we have one planet in which we need to protect as well as we protect our brain. And at the end, this is a positive sum game if we manage to do it as humanity. So I would like to move to Marta, your cluster, and how you see this, and of course the data. We heard a lot of data and how to deal with the data. How do you see all of this?
Thank you. Well, thank you very much for being here, and let me explain in a very humble manner, because after such honorable speakers, I mean, there's not that much I can add. But from our side, from WeMind cluster, I remember myself in 2015 when we start as the young Cluster Salut Mental Catalunya. We were holding 647 enterprises dedicated to mental health here in Catalonia, and a very low GDP for the region. So that was not even a 1% of the total GDP that we were promoting by this sector. Then after, in 2023, when we repeat our strategic update and market report, we saw that the growth of the companies that were dedicated not only to mental health, but transversally as well, focusing on personal autonomy, because longevity was impacting, the cognitive decline, early stages of mental health at infants, adolescents, and young were growing in prevalence. We saw that the number of companies that we can count in Catalonia were more than 9,000. So the increase was fairly incredible, and the increasing ratio is year through year more than 5% growth in companies dedicated to healthcare, to mental health care, to longevity, nursing homes, research centers or technological companies that were focusing their innovation on trying to tackle this burden that you have been discussing or tackling before, right? So that comes with 9,500 million turnover in 2023. It's even growing for the next upcoming that we are preparing for next year. So the idea of having at that time a cluster focused on let's impulse the competitiveness of such a marginal segment of the companies was, could we do something? How can we transfer this innovation? How can we push the private sector to move into these societal challenges that were about to grow, but not seen really as an opportunity market for developing products or services, because everything remains on the public, on the public sector. So from this moment and after the COVID, when the mental health burden started to really blow up, the stigma was a little bit declined, and more openly we were discussing about mental health topic and transversally about the brain health that we are now talking about this human potential, where we were happily meeting with EMEA and focusing on the idea of let's talk about this paradigm of this brain capital, this central capital, and how can we move forward. So since then, we have been discussing and supporting the brain capital ideas and the human potential as well, beyond intangibles, as you were saying, because we work as a cluster with so many intangibles, with professional excellence, with innovation, with ratios of technology transfer done, with studies in research. But we need still to hold one key topic that for me is a mean, it's not the final objective, which is the data. How do we manage data? How can we transversally use in a federated manner, in a secure manner, and with people data governance, with European Act that is now put in place, and how can we help as well to support this transversally, not only from ingesting data from the public sector, but as well from social networks, from open data sources, from private sources, so that we can create this consortia, we can create and replicate the number of projects that we are working among different actors of the 4 helix ecosystems in which we are living in, and replicate that into extracting AI insights from this data. So trying to deep dive into complex data and trying to get this unknown forecasting, unknown prevention, unknown trends that we could extract and use to provide this better biopsychosocial environment for the user, and to create, with the final point of going to create the resilient society. So for us, it's really a challenge, and we are pleased to support from this cross-public and private collaborative angle in which we are influencing, and we hope that we will divulgate more, and we will use data spaces and data to create these synergies, making real.
Thank you very much, Marta. I also wanted to recall one thing which the father of economics, Adam Smith, spoke about skills and knowledge as a form of capital in the 18th century. But back then they were looking more for wealth and not eventually for health. Maybe they were healthier than us, I don't know. But certainly the priority was wealth creation. Now, in my view, for the societal challenges we are facing today, our main priority should be health recreation and regeneration, in fact, because I think we have reached a high level or levels of science creation that is or must involve our lives, impact our lives much more than just spending. So that is why brain health and mental health is a strategic asset. And we are presenting it as a strategic asset in which we must invest. Now, I would like to make one question. How do you see the investment policies in this asset, in this strategic asset? I would like to start with Andy.
Sure, no, thank you, Rim. I think that one of the things that we found at the forum that, as you mentioned, some of these terms have been around for some time, but I think really bringing that into the fore for policymakers and also for decision makers, within corporate organizations, it takes time. And so I think that where we are today is that there is an acute need for this focus on brain health, but I think still we find ourselves in an environment where people are becoming familiar with these concepts, and we're still at the mobilization point of speaking with one voice with some consistency, which we've enjoyed over the course of this year with partnership with you and others in the room. And I think that really it'll require that kind of consistency and communication and clarity to really bring policymakers around to making a consistent set of investments, having a brain health plan in place. We do see that in a few economies, but it's not as pervasive as we would like. And so I think continuing to bring forward the measurements, how this improves productivity at a national economic and regional economic level, but also for individual organizations will be critical.
Lucy?
Just building on what Andy has been saying, I mean, there's a really big shift that needs to happen from looking at health as a cost to health as an investment, and that is foundational, right, to what we're looking at here. I think we can celebrate that. The business case, I think it's increasingly clear for most folks about why this investment is so critical. And so having that as a foundation, having now like a common framework for how we talk about this, how we measure it, the work that you're doing, right, in building like that alignment around the metrics is essential. Is it going to be a one-size-fits-all? Of course not. But this is where the coordination becomes so important, right, to ensure that we also learn from each other what's working, what's not, and we can adapt, right? And building in that adaptability will help us get to that better outcome.
Thank you. Yeah, completely agree with you. In my experience, it is not yet clear to the ministries and the politicians that brain health should be a priority. This is what we have learned, right, from our own experience in trying to boost brain health as a priority in all policies. And the problem is that it's very transversal, right? So it doesn't mean only health, it means education, it means urbanism. We need brain-friendly cities, right? We need cities in which people with cognitive problems or mental problems can navigate safely and without this cognitive burden, right? But the problem is that this is not clear for the people. So to me, and you have mentioned this also, the first thing is that we need to educate people in what means brain health. This is the first thing that we really need to do. The second thing for the policymakers is that we need to show them that it is an investment, because they don't see it as an investment. At least in my experience, they don't see it like that. So, for example, we are launching some studies, pilot studies, in which we are trying to show the socioeconomic impact of improving brain health, right? With some pilot clinical studies that we are doing in collaboration also with the Fundació Pasqual Maragall. So I think it's a lot to do yet, but it's good that it's growing and growing, right?
Well, I agree completely with Lucy and Mara. Brain health and health in general must be in all policies. It's not only talking about healthcare, it's talking about housing, and employment, education, and so on and so forth. So that's the first idea. For that, we need to have a clear plan. And I think that the plan of the Spanish Council, Brain Council, is pretty good and must be adopted by the authorities. And also, the second idea, I would say that the action plan derived from different pillars must be deployed with the 4 Ps, with private, public partnership, and also philanthropic partnership. That's very important. Governments cannot do everything everywhere. So you need to have all the society involved in this change of in this change of this paradigm of brain health.
Well, from our side, I would say that I still see the investment not enough, scarce. I think that from the different sources that Josep has mentioned, we should improve the volume that we effectively dedicate to mental health and to personal autonomy solutions, not only in research, but as well in developing, creating more startups, scaling up these startups, putting a little bit less pressure on regulatory topics, because I think that everything that is done in startups in other sectors are easily scaling up rather than, for example, health or mental health or wellness applications. And in that sense, I would say that we all need to divulgate more on the brain health economy. That's why the merge among the industry and the health and both sectors could be effectively giving results, and that's the point. If we make it bigger and transversal, then the number of projects that could be promoted from this initiative should be higher, and then the impact as well much more measurable and much more effectively taking action into the end user with these all unmet needs that we are focusing and had been shown today.
Thank you, Marta, Josep, Mara, Lucy, and Andy for this great discussion. I think I need to close this session now, so I hope this is something that brings some new ideas. Of course, I don't see a future without investing in our brain health, and this is the firm, and you mentioned, Josep, that we need to have a collaborative effort between private sector, public sector, and philanthropic organization, and also the research and university organization. These are the leaders, in fact, of the ideas and the research, and it has to be there implemented in our economies, in our societies, to reach the flourishing. And as I said, the brain capital concept is so important because it connects silos. Before they were silos, health, education, economy, and now they are all together working all in collaboration. So with this, I would like to thank you all for your patience and thank the panelists and the 2 days. I hope you learned a lot during those 2 days, and thank you, Marta, again for the great organization and all the team.
Thank you very much.